All right, let's dive right into something that hits close to home for almost all of us at some point. Whether you're chained to a desk all day or you're out there doing heavy manual labor, we are talking about debilitating lower back pain. It literally stops you in your tracks, doesn't it? It dictates how you move, and honestly, it can be incredibly frightening. But today, in this explainer, we're going to break the whole thing down. We're going to make it understandable and hopefully take away a lot of that fear just by looking at the science.
So what is actually happening when you get that sudden, severe lower back pain that shoots all the way down your leg? You've probably heard people say they slipped a disc or blew out their back, right? But what does that actually mean under the hood? Well, we are going to investigate the real biological culprits behind your pain. And as you'll see, we need to move way past the idea that it's just a simple mechanical breakdown.
Okay, first things first, let's define our terms. The actual medical term for a slipped disc is a herniated nucleus pulposus, or HNP. Think of your spinal disc kind of like a jelly donut. You've got this tough outer pastry layer, the annulus fibrosus, and a soft, jelly-like center called the nucleus pulposus. And HNP simply means that the jelly center has pushed out through a crack in the outer layer. And when that jelly protrudes, it can squish right up against the highly sensitive nerves sitting right next to it.
Here is our roadmap for today. We're going to cover the reality of back pain, dissect the anatomy of a herniation, assess your personal risk factors, and finally outline a really solid stepwise recovery plan.
Let's start with Part 1, the reality of back pain. And trust me, it is a multi-dimensional burden.
Moving right along to Part 2, the anatomy of a herniation. This isn't just a physical pinch, it is a full-blown biological event.
Think of a herniation as a downward spiral. It kicks off with predisposing factors, things like heavy mechanical load or just sitting too much over the years. That triggers degeneration. You lose hydration in the disc, it gets less elastic, and you start getting these tiny micro tears in the outer layer. Once that structural strength drops, boom, the disc herniates. That leads to mechanical nerve compression, a massive inflammatory response, nerve sensitization, and finally, all that agonizing pain and numbness you actually feel.
Let's break down that chronological failure step by step. In step 1, usually just due to age and daily wear and tear, the disc literally dries out. Step 2, because it's dry, that outer layer gets brittle and starts to crack. By step 3, extrusion, the pressure literally squeezes that inner jelly right out through the cracks. And step 4, that's the kicker. That extruded jelly hits your nearby nerves and completely sensitizes them, sending alarm bells ringing through your entire nervous system.
Now, here is something absolutely crucial. You might want to mentally underline this. The pain you feel isn't just a physical pinch from that squished material. It's actually a chemical fire. These degenerated discs release incredibly high levels of pro-inflammatory molecules, specifically ones called interleukin-1 beta and TNF-alpha. It's basically like throwing gasoline on your nerves. This beautifully explains why sometimes a patient's pain is off the charts, even if their MRI only shows a tiny physical compression. The nerves are literally being chemically burned.
And this whole biological aging process, it shows up in the surrounding bone too. If you look at an MRI, doctors often point out what are called modic changes. These are actual changes in the bone right next to the discs. It basically means that senescent or aging cells are piling up, creating this toxic pro-inflammatory microenvironment, and that drastically reduces your spine's natural ability to heal itself.
All right, Part 3, assessing your risk factors. What actually puts you in the danger zone?
Well, there's a really clear line between what we're stuck with and what is totally within our control. On one hand, we have non-modifiable risks. Getting older, your genetics, we can't do much about those, right? But look at the modifiable risks, your weight, how much you sit around, and the physical toll of your job. Knowing this is actually super empowering because it proves you have massive leverage over the health of your spine.
Let's talk about specific daily hazards. Are you slouching right now? Prolonged forward bending is a huge stressor. Repetitive heavy lifting over the years, especially if you're a manual laborer or a nurse handling patients, really accelerates that early micro damage. And yes, even prolonged sedentary gaming behavior among younger folks is a recognized hazard. It severely elevates the pressure inside those discs.
And here is exactly why sitting all day is so dangerous: muscular atrophy. When you don't use your back muscles, they weaken and shrink. Now, those muscles are supposed to be your spine's built-in shock absorbers. So when they fail to do their job, all that crushing, compressive force is transferred straight to your poor spinal discs, radically speeding up their breakdown.
Which brings us to the good news. Part 4, the stepwise recovery plan. Let's look at how we manage this.
Prepare to be amazed.
Current medical evidence shows that over 80% of patients, yeah, 80%, experience spontaneous symptom improvement within the first few weeks without ever needing surgery. It's true. In fact, the worse the herniation looks on a scan, the more likely your body is to naturally clean it up and resorb it. Your body is incredibly capable of healing itself.
Because of that awesome healing capacity, doctors follow a really strict escalating path. Step 1 is conservative therapy, usually for the first month to 3 months. If you're still in agony, we move to Step 2, epidural steroid injections. These are basically a bridge to cool down that chemical fire we talked about earlier. And we only move to Step 3, surgery, if those first 2 fail or if there are severe progressive neurological issues.
So, what does that crucial first line of defense look like? Well, conservative therapy is a mix. It includes medications to manage the pain, paired with highly structured physical therapy. We're talking McKenzie exercises and lumbar mobilization to help reduce the load on the disc. Plus, combining this with adjunctive therapies like acupuncture and relaxation techniques does wonders for dialing down the body's overall pain response. But hey, we have to acknowledge that sometimes surgery is absolutely the right call. The North American Spine Society lays it out perfectly. They say that a discectomy is highly effective if you've been doing the conservative work for more than 6 weeks and that shooting nerve pain just won't quit. In those cases, surgeons go in, often using minimally invasive techniques like PELD, and physically remove the fragment that's crushing the nerve. It offers incredibly rapid relief.
What really gets me excited, though, is the future of spine care. It isn't just about cutting away the damage anymore. It's about reversing it. We are seeing incredible emerging regenerative therapies right now, like mesenchymal stem cells and platelet-rich plasma, or PRP. These biologic treatments actually aim to restore the disc's structure and target that underlying inflammation to heal the disc from the inside out. It's a total game changer.
So, we have covered a ton of ground today. The mechanical breakdown, that fiery chemical inflammation, and the incredibly hopeful pathways to recovery. So, I want to leave you with this provocative question. Knowing exactly how a disc breaks down, what is one modifiable risk factor you're going to change today to protect your spine? Are you going to fix your posture right now, start strengthening your core, or just take a quick break from sitting? The power to protect your back is literally in your hands. Thanks for hanging out with me for this explainer, and as always, keep learning.